How does the way a mother experiences pregnancy, birth, and postpartum shape her long-term health and well-being? These transformative moments can impact not only physical recovery, but also emotional resilience. Yet, many mothers and birthing people, especially those facing perinatal mood and anxiety disorders, find themselves feeling isolated and unsupported. In today's episode, we're exploring how maternal health, occupational therapy, and pelvic health therapy can bridge these critical gaps in perinatal care, offering holistic support for both body and mind. If you've ever wondered how to prioritize your health and well-being during pregnancy or beyond, or how to support a loved one through these transitions, join us for today's insightful conversation. Hi, I'm Debra Pascali-Bonaro, founder and director of Orgasmic Birth and host of the Orgasmic Birth podcast. I am so honored that today's guest, Lacy Woods, is a mother of two boys, a perinatal and pelvic health occupational therapist, and an OT educator. She is certified as a pregnancy and postpartum corrective exercise specialist and provides individual, group, and virtual services through her private practice, Maternal Milestones. Welcome, Lacy.
Thank you. I'm so excited to be here with you.
I am too, and I so appreciate you coming because I get the benefit of having read a bit of your story and knowing, and I know that you have so much learned wisdom to share. Can you take us back to kind of your birth and your pregnancy first and birth of each of your babies?
Yes, of course. I feel really grateful to be able to share these stories and what I've learned. And so many women, I think, learn so much from their experiences, and the more we share them, I think the better off we all are. So my first birth was in the hospital. And just for some context, I found out that I was pregnant unexpectedly 1 month into COVID lockdown. So it was April of 2020. And I was working full time in healthcare in the hospitals. My husband and I weren't married at the time, but uh, he was teaching. And so he was navigating the whole virtual teaching realm and a lot of unknowns at that time in the world. And especially, we didn't have parenthood on our radar at all for the near future. So there was a process early on of coming to a place of acceptance. And I did struggle with my mental health initially with that pregnancy, but I did do it right away that I wanted to have an unmedicated birth. And so but what I wasn't informed on, I guess, what I didn't know is what my choices or options were as far as who my care providers were and where I would give birth. So I kind of just found myself going the typical route that I knew other women around me had gone, which was scheduling an appointment with an OB. And I don't even remember doing a whole lot of research as far as what practices, or who I ended up going with. And so I just called one and they could get me in, and that was who I ended up with. And so I ended up at a practice that had about 9 OBs and 2 midwives. And their policy was that you had to rotate through all of the practitioners throughout your prenatal visits, because when you went into labor, you would just get whoever was on call. And I thought that was odd at the time, but I didn't really question it. It was all I knew. And so the prenatal visits, you weren't really getting to know any of your providers and forming a relationship. And, as an occupational therapist, we value this holistic client-centered care, meaning that each person is treated differently, regardless if they have the same condition or diagnosis. We're looking at things like their values, their beliefs, their habits, roles, routines, environment, their support systems, right? Because all of those things impact who they are and, their life. And so I felt a little bit disappointed with the prenatal care. And I think that's kind of what set me on this path of doing a lot of research for myself and getting really engrossed in everything, prenatal and birth and postpartum, and learning everything that I could. So when I was 30 and a half weeks pregnant, I fell down a flight of stairs. And so I had to go into the hospital and be monitored. And so I was monitored for 6 hours and they sent me home. And later on, I was walking and I felt this really sharp pain down my right side. And so I had to go back to the hospital, and they gave us the same hospitalist OB that second time, as we had the first time, even though there was an OB from my practice there, they didn't ever consult with me when I was in that triage phase. And so the second time I really felt like something was off and wanted more testing, but the hospitalist OB that we had was visibly disappointed, or I think annoyed that we had come back, and was unfortunately pretty rude. And we really had to advocate for ourselves. And I say we, but I was almost speechless. I kind of froze. I was really emotional, and I'm really grateful that my husband was able to speak up and ask for further testing, ask for an OB from our practice. And fortunately, they complied with that and sent somebody else in who did the testing and found that the baby's blood was in with my blood, which I guess is an indication of a possible placental abruption. So they decided to keep me overnight. That the test came back around midnight, and so I stayed. My husband went home, and the plan was to do an ultrasound in the morning to see, what they could find. But the morning came, and they decided that they weren't going to do the ultrasound because they couldn't be 100% sure either way, and they wanted to induce. And anybody who I talked to throughout my pregnancy, I was like, there is no way I'm getting induced. I knew that I wasn't going to take like a 39-week induction, or, I wanted as minimal intervention as possible, knowing that that was kind of the way to have an unmedicated hospital birth. But it, I think was the right choice for the situation. And so we moved forward with that. My husband came back with, all of my birth ball and all of the materials that we had. I had, fortunately, a really detailed birth plan that we had worked together on. And I think it was multiple pages long, put in, all my wishes and everything, which I'm grateful for. And they started the induction with the Cytotec insertion at about 1 p.m. And that was on December 18th. And then they started the Pitocin, I think, sometime around 4 or 5 p.m. And early on, I feel like I was managing pretty well. I had to be on the continuous monitors, and I had to be on the IV because of the Pitocin. And so I wasn't able to find movement like I had imagined, but I was doing pretty well. I put my headphones in, I turned the lights down low. Part of my birth plan was that I didn't want people to interrupt me. And so they really did let me have that time. And I just moved however felt good and how I could, even with the limitations of the lines and things like that. But the unfortunate thing with Pitocin, I know this is true for so many women, it doesn't act like your regular oxytocin, right, of having contractions. And so I wasn't getting that nice build and then a peak and then it comes down. It was kind of staying at like a 7 or 5 in terms of intensity, and I wasn't getting a lot of rest. I also felt like I had a really bad flu with the Pitocin. So I was having the shakes and diarrhea, and every time I needed to go to the bathroom, I was having to call the nurses in to get unplugged. And then I felt like I was an inconvenience. So toward the, end of that day, I was starting to feel really exhausted and a little bit discouraged, but I was managing well. My husband was really helping me through. I wanted to be in the shower so badly because that did bring me some relief, but because of being on the IV, I couldn't get in all that often. So I think I maybe went in once, maybe twice. And whenever I would come back out, I would try to be in the bed. I wish I had like a yoga mat or something because I wasn't able to find comfort. I wanted to be on the floor and moving. But regardless, I went through that night, didn't sleep at all again. And then that next day, the Pitocin had to be started and stopped a bunch because his heart rate was dropping. And that was getting, frustrating. But about 25 hours into labor, my water did break on its own. And I remember the nurse being there beside me, and she was so comforting. She was rubbing my hips, but that's when things really intensified. And she was telling me to let go and relax. And I just really was struggling to do that. I was feeling really weak. I started vomiting at that point. And she asked if I wanted to be checked, and I said yes. And she checked me, and I was only 1 centimeter. And I just remember feeling so defeated and discouraged. But, and that's when I asked for the epidural. So they brought the epidural, and Honestly, although it wasn't in my initial birth plan and I wanted to do everything I could to avoid the epidural, it feels like the right choice for that situation. I just wasn't able to relax after, 2 nights of no sleep, and um, I was so uncomfortable, and I'm grateful that I did get the epidural because I there was a shift right after I got the epidural. I could be in the bed. It was December 19th at that point, so right before Christmas, there were Christmas Hallmark movies on. I could kind of relax and just watch a show. And about 4 hours later, I felt like pressure, and I felt down, and I felt the baby's head. And so everybody got called in. I put in my headphones. I knew I wanted to be on my side to push, and I knew I wanted to do the open glottis pushing. So I was still really firm in that and communicated that to the team. And yeah, the pushing phase was the the easiest part. It was only like 15 or 20 minutes. I was in my zone with my music. I felt so encouraged, and I was not at all aware that there were like 7 or 8 people in the room. But, yeah, when, the baby came out, we didn't know what the sex was, and so the OB announced that it was a baby boy and brought him to my chest immediately, and, yeah, I get chills just thinking about it now. It was, so beautiful from that point on. It was everything felt, worth it, and to have your baby there in your arms, and he breastfed right away. It was wonderful.
Thank you for sharing. And, you know, just I love how, sometimes the unexpected, right? That's why we call them often preferences. We never know what labor will ask and what our baby needs. And I am really sorry to hear that you fell down the stairs as kind of a beginning to the process, but that both you and your baby were healthy and you were able to navigate that. Now, what was that postpartum like? How were you feeling in the, weeks after?
So, it's funny that you go back and mention the falling down the stairs, because I think what that taught me was that I was trying too hard to control things, because the reason I was going down those stairs was it had just snowed, and I was going down to get my snow pants to go out and shovel snow at 38 and a half weeks pregnant, because I was like, I'm going to put myself into labor. Like, I wanted to, I really thought, looking back, I really believed that I could control when the baby was going to come. And so to tie that into my postpartum experience, honestly, I felt really good, and but I when I look back, I see that I still kind of had that in me, where I felt like I needed to control everything, and I had a lot of anxiety looking back, even though in the moment, I think I felt, uh yeah, it was that excitement, right? I think I felt excited, but then I look back and I'm like, I was actually pretty anxious about, I was trying to control his sleep right away, get on a routine. But I had 12 weeks off of work, and I really did make the most out of that time and enjoy just being with him. But looking back, I can recognize that I definitely had some anxiety, and yeah, that control aspect was certainly still there.
Yeah. And thank you for sharing that because I think that's for many people, right? This is a big change, and we bring into it a lot of our past patterns and ways of being. So, what was the gap between your next pregnancy? When did you
I
welcome
think
in another?
I think my son was about 2.5 years old when we decided to try again, and that felt like a good spacing for us. We knew he'd be about 3 when the second one was born. So I think we started trying maybe in April of 2023. Yes, and so, unfortunately, we got pregnant right away, and when I found out about that pregnancy, this time it was planned, and so we were more excited, right? We didn't have that shock of the first time around, but I was surprised that I did still struggle with my mental health, even though it was a chosen pregnancy. I think, and talking to other women, I realize now that it is somewhat common to have these feelings of, I think it's just really an intense realization, right? To become a mother, whether it's for your first time or your second time, you just kind of sometimes get hit with the realization of how much is really going to change, and kind of yeah, what the weight of what that really means. So with that second pregnancy, I had an easier time initially, but I remember I knew right away that I wanted to try either a home birth or a birth center. And I was following somebody at the time who was actually having a wild pregnancy and a free birth. And I remember listening to her story and being so inspired. And that's what really, I think, solidified for me that belief in physiological birth and, our innate wisdom that we have as women. And it allowed me to really tune into my intuition and follow what my inner desires really were instead of that pattern that I'd always been in of, trying to read and learn and research everything, which I think is really beneficial. But there's also, there's both sides that I think are valuable. And so I found a midwife that I really resonated with. And this time I gave a lot of thought into my care provider and I interviewed several midwives before I settled on one. And I remember she asked me if I wanted to do the initial dating ultrasound. And I initially turned it down because I wanted as little intervention as possible. But I soon felt like I just had this inner knowing that I was pregnant with twins. And I had a hard time describing it to people, but I remember telling my husband and my mom, my best friend, I'm like, I just have this feeling and I don't know how to describe it. It wouldn't make any sense, but I just have a feeling that um, I'm having two babies. And so I called her back and asked to get in for that initial ultrasound, and sure enough, I was pregnant with twins, and that came as a shock. Even though I had that inner knowing, it still was. I couldn't believe that I was right, and yeah, again, I kind of found myself in this position of trying to find acceptance, right? Of having a plan in my mind of what it was going to be, and then having to shift that idea into something, new. I only ever saw myself having two kids, and second time around, I knew how hard it is to take care of a newborn. I, couldn't imagine doing it with two, but I was also really excited, and it felt so special. So when I was 13 weeks, I think the midwife came back and did the Doppler, and there were two heartbeats. And that was when I was like, okay, we're doing this. We're having twins. She did tell me that she was going to change over my care to another midwife who she partnered with, who was skilled in home birth or breech birth and twin home birth. So, and I felt comfortable with that. And I loved her as well. But when I was about 15 or 16 weeks pregnant, I found out that I lost baby B, and it's even hard to talk about now, almost over a year later
Yes.
from when we found out. But my morning sickness had gone away, and then it came back around 15 or 16 weeks, and I was really nauseous, and I had a 10 out of 10 headache and a fever, and so I assumed that I was sick with something, but it felt similar to when I had viral meningitis in the past. So I went into the hospital. They kept me there, did MRIs, and I remember telling everybody who came in the room, I'm pregnant with twins, I'm pregnant with twins, just to get them, I wanted them to be safe. And
Yes.
nobody would do an ultrasound. And I kind of just was like, okay, I guess they're not concerned about it. And they sent me home, and those symptoms continued for 3 days. And I was told to alternate Benadryl and Tylenol every 3 hours. And I was doing that and still dealing with this really intense headache. So I went back. And fortunately, we had a great hospitalist who allowed me to get an ultrasound, and that was when we found out that there wasn't a heartbeat with the second baby.
I am so sorry for your loss and how challenging, right? The emotions must have been at that time because you're still pregnant with one, but you have a loss.
Yes. And I
Was
think,
there support? Like how were you and your husband able to move up through that time?
oh, I mean, we did have support. And, one of the things that I'm most grateful for is that I had told people close to me that I was pregnant with twins. So, everybody at work was aware at this point. And so when it happened, I really felt our community, surround us and give us the support that we needed. And, I I did. I felt like we had the space to grieve initially. I think what was difficult was kind of people never know how, right, to respond to a loss like that. And I think, having one surviving baby, I kind of felt pressure to just feel grateful for what we did have. And there wasn't, sometimes I felt like acknowledgement of the grief that we were feeling for the loss. And that was kind of the theme of moving through that for us. Was it was really difficult for us to hold both things at one time. The gratitude for still having a baby and loving that baby, but also it didn't at all really dampen or decrease the grief that we were feeling for the loss that we had. Um, and for people that didn't know that I was pregnant, right, they would see my growing belly and they would say, "Oh, congratulations," right, which is a perfectly normal response to seeing that somebody's pregnant. But it hurt me, right, to because I felt like by acknowledging the congratulations and the excitement of the pregnancy that I did have, I was ignoring the loss that we had and somehow dishonoring that baby that we lost. And I struggled with prenatal depression really profoundly. Um, I it was difficult, and I did eventually find a mental health counselor who was certified in pregnancy or perinatal mood and anxiety disorders and perinatal mental health through the same training that I did. And she was also trained in somatic therapy. And that was amazing to have somebody who had the knowledge and background of understanding, you know, mental health issues related to motherhood, but then also have that somatic experience. I really feel like working with her weekly was a huge part of me, one, being prepared for birth, but also really recognizing the trauma that still lived on in my body and processing through not just the psychological challenges, but the physical grief that I was feeling as well. So with my second birth, I was 41 and a half weeks. And if you had asked me earlier on in the pregnancy, I would have said, there's no way that I am doing anything to induce this labor, right? I'm going to let this baby come when they want. I had learned my lesson, but at 41 and a half weeks, I was so ready to move on to the next chapter. It was mentally getting really difficult to continue on with the pregnancy. And so I went with what is sometimes called a midwife's induction. And so my midwife did a stretch and sweep, and then I started pumping protocol and then did a mixture of tinctures and then eventually castor oil. And that was on February 14th, so Valentine's Day of 2024. And that did start labor. So did what it was supposed to do. And one of my simple pleasures in life is winter walks, and I love walking outside in the winter. And so I was doing that all day. Contractions were coming, and the best part was I felt so much gratitude for the contractions that time around, right? I was just so happy to be in labor and know that my body was doing what it needed to do to, help me progress along. And I had had some prodromal labor for like the 2 weeks leading up to that. So the fact that they kept on coming, I just remember keeping on saying in my head, thank you, thank you, thank you. Like I was thanking my body for bringing my baby closer to me. And so I labored throughout the day. And I remember at one point when things were really getting intense, the midwife told me to call the doula because she was an hour away. And so she came and things stalled. I think I kind of maybe subconsciously felt the pressure of having somebody there and like, this is, go time. And so my body just kind of stopped having contractions temporarily, and she was wonderful. She left and went to a coffee shop, and I laid down on the couch to watch a movie. I was like, and now is the time where I just need to relax and let this happen. And sure enough, after like an hour and a half, they picked back up. And my mom went and got my son from daycare, brought him home. And so I had some moments with him, having it be Valentine's Day. He came home with all of his, treats and goodies from his friends and got to unpack those. And I was still moving through those contractions, but I was managing and just happy to be in his presence too. But she eventually took him to go stay in a hotel that night. And when he left and got out of the house, my body was like, it's go time. And so that's when we started filling up the birth pool. And once I got in there, I felt such a sense of relief. I loved being in the birth pool. I was so glad that we had it, and labored in there for a couple of hours. And right when I was in transition, I remember distinctly that happening because I felt that flightiness where I was like, I got to get out of this pool. I got to go somewhere. I got to get out of here. And so I went to sit on the toilet, and that was really intense. And I went to go lay down on the bed, and that was really intense. And eventually got back in the birth pool, and that first fetal ejection reflex just caught me by surprise. I remember exclaiming to my midwife, I'm pushing. I just couldn't believe that it was happening so quickly, it felt like. And it was amazing to me, how forcefully, like, the body is just, like, ready to do its thing, and there was no stopping it. I couldn't do anything if I wanted to. And I remember also being somewhat surprised at how much rest was in between those push contractions. So I would get that reflex, that push contraction, and then it felt like I had like 2 to 5 minutes in between, where I could rest, and I would kind of come back into presence. But it was interesting because I felt so in my body, but also just not present in the room during those contractions. I was riding the waves and breathing through them, and I was having fun. It was really fun to yeah, it was intense, but it was truly pleasurable. And um I remember as I was getting closer, the his head came out and it was still in the sack. And my midwife kind of gave a look to the nurse assistant, and I could tell that she was somewhat concerned about a shoulder dystocia. But then ultimately, I remember her saying that it was his hand was up by his face, and then he had a nuchal cord, so the cord was wrapped around both his head and his hand, and so it was making pushing more difficult. I knew that I needed to relax down, but what I really felt like doing was like pulling up and in. So I was able to move through that with some coaching. And so the baby came out, and the sac broke once his body was out in the water, and pulled him up to me. And his eyes were open, but he was quiet. And they just kind of gave him time. And I think his heart rate was low. They did suction him, but the whole time he was on me. And anytime she would, take him, she would give him right back. And then he cried, and got to hear his strong little voice. And yeah, it was amazing. The placenta came out, I think, 15 minutes later, and then had the hour in the birth pool. And the best part of it all was just getting out of the birth pool and going to the bed to relax. And we did a cord burning ceremony, which is really beautiful. It felt like a nice way to honor the placenta and, the cells of the baby, that were still part of that. And yeah, I felt so much gratitude and strength. I was so proud of myself and my husband, for moving through it in the way that we did.
Wow, I'm feeling so much of all that you shared and just your strength and the beauty, and to know that you were just so connected to your body and your baby and feeling, joy and pleasure in that moment, and having the team around you that really knew you, really honored your journey in the way that you were going through it. And what was that postpartum like? Because I'm wondering how that was, because you were welcoming and had a beautiful birth, but I want to honor there still was loss.
Yes. That postpartum was truly blissful. I think I was really concerned about the emotions that might come up afterward, with having, the baby in my arms and kind of recognizing the baby that wasn't there. And I did certainly have that. I continued to work with a therapist in postpartum. But I think there was a shift at a certain point of just gratitude. And I still was very much moving through that grief. I still feel that, every day. I feel like I still think about the baby that we lost, and it'll catch me sometimes. But I really feel like this time I did honor the my own need for rest and relaxation and to feel my feelings and not feel like I need to control and, perfect everything. And I think having that letting go really made for a completely different experience my second time around, where I just solely enjoyed being present with my baby and with my husband and myself.
And thank you for sharing that, Lacy, because I know, you had support of others and this was a healing journey. And you were able to hear how you were able to stay in that gratitude, that pleasure, that moment, and have this birth that transformed you in so many ways. How has that kind of birthed forward now into your practice and your work?
I think the biggest thing is recognizing that there is a balance between knowledge, the scientific side of things, knowledge, research, but the intuition. And that has changed so much of how I interact with my patients, both in the hospital and then through my private practice, is trusting that, people know their bodies. And I've always really prided myself on honoring the individual person who's in front of me. But I think, one of the things with healthcare sometimes is that we tend as healthcare professionals to think that we are the expert, right? And I have really removed that from my, I guess, vocabulary and the way that I treat patients is trusting them as the expert on their body and tuning into what it is that they are feeling and needing from me in that moment.
And can you give some examples? Because I know you're blending some unique skills. And as we said, even in the intro, right, you're doing both the physical and the emotional and bringing that together. How is that preparation valuable for people that are listening that are pregnant?
Yes. So I think tuning into your body is one of the most important things you can do because so many of us, and this is something that I've learned over time, is we tense through life. If you are, taking care of other children or working, tension builds up over time in all of us. And so many of us will clench our jaws, clench our butt cheeks together. So we're getting a really tight pelvic floor. And it's not really until we take a moment in our day-to-day life to tune into that and really release that tension. And I think that is something that one of the first things that I teach clients to do, especially during pregnancy, is to start to become aware of their body and release, open. I know that so many women believe that Kegels are the way to prepare their pelvic floor, but it's actually the opposite for the majority of women. So many women have already hypertonic pelvic floors or, too much tone. And so relaxing is really the skill that we need to build on. And you can't really fully relax until you're aware of where you're holding tension. So breathing into your body and really focusing on lengthening those tissues, your pelvic floor, allowing your ribs and your back to expand with your breath as much as you can. And trying to avoid breathing into our chest, which we tend to do, and stimulates our sympathetic nervous system and counteracts relaxation.
Fantastic. I love your work and couldn't agree more, right, on how much it's needed. Is there one last thing you'd like to share with everyone that you would give a tip for someone that's listening from your lessons and your practice?
I think so often as women, we ignore our own health. So whether it's we're having physical symptoms or mental health system symptoms, I think we often will ignore those to deal with other things, right? We're more interested in dealing with like whatever our children are going through. But I really want to encourage women to seek help if they are having one pelvic floor symptoms or mental health symptoms, like struggling to cope with pregnancy, or if they're dealing with prenatal depression, and trying to eliminate the shame around that. And same goes for any if you're having incontinence or leakage. There's really no shame surrounding those things. We need to be better about at seeking help for ourselves.
Thank you so much, Lacy. I know that you've touched many people in your own story and in the work that you do. Can you share with people how they can reach you, what services you offer? I know some in person, but you also have online where people from anywhere could be in touch.
Yeah, so I have virtual wellness services that are pretty much accessible to anyone, regardless of where they are in the world. One of those is individualized birth planning. So I help women get clear on what they desire for their births and design a personalized birth plan, which is great for anybody who isn't sure where or how they want to give birth. They're not sure if they want an epidural or kind of how they want to proceed. I help kind of sift through their innate desires and intuition, but also looking at the evidence for different choices. And then I also offer personalized prenatal and postpartum fitness plans. So we do a virtual assessment, and then I give you a fitness program and guidance to make sure that you start exercise safely or you resume afterward safely. And if you're in Virginia or West Virginia, I'd love to see you for pelvic health. I do virtual visits for that as well, but I do like to do an in-home evaluation. And then we work on a program that fits your unique needs, right? So it doesn't have to be every week or every month. I kind of go off of what each individual wants and needs.
Fantastic. And where can they find you? Can you share your website or social?
Yes, so I am at Maternal Milestones on Instagram, and my website is the same, maternalmilestones.com. And I also want to mention I'm working on some research this year for maternal mental health. So if you follow me on Instagram, you'll see the link for that. We're looking for moms to kind of discuss internationally the resources that they have available to them, and then the barriers to accessing those resources. So we want to learn more about maternal mental health.
So important. So all this will be in the show notes wherever you're listening or watching. Please look below. And we really want to thank you, Lacy, for your vulnerability to share your journey, for all that you're doing to use your own experience, both personally and professionally, to offer such care to so many others. So thank you for joining me today.
Thank you, Debra. I really appreciate the opportunity.
And thank you to our listeners. We really value and appreciate you, and we love to hear from you. So please tag us both on Instagram, send us messages. What are you taking away? How is your journey going? You are a big part of why we're here today is for you. So we look forward to hearing from you. And we always appreciate it if you can rate and review our podcast. That's a way of helping us reach more people, or share this episode with a friend or a colleague, someone that you know will benefit from listening. And we hope you'll join us next week at the next episode of the Orgasmic Birth Podcast.